SSON News at 4:20. I'm Emily Betts. Today's top story, the prevalence and levels of prevention of HIV and AIDS. HIV is a virus that causes AIDS that enters the body and multiplies in the white blood cells, which weakens the immune system. HIV is transferred through bodily fluids from one person to another. Reports show that 240 people are infected with HIV every hour. In 2013, there was an estimated 1.2 million people living with HIV in the United States, and approximately 13% of these people were unaware of their infection. Now, here on SSON News, we will be progressing through the levels of prevention to inform you about what to look for if infected and the steps to take in preventing this disease in different stages. Here to report about primary prevention, we have Lena Craigmile reporting in the field. Over to you, Lena.
Thanks, Emily. My part of the story today covers the goal and strategies for the primary prevention of HIV and AIDS. The goal of primary prevention is to prevent injury and disease before it even occurs by preventing exposure to hazards that may cause said injuries or diseases. Examples of primary prevention include, but are not limited to, targeting legislation enforcement, educating the public about safe practices, and immunizing those at high risk. We will go more in depth on specific ways to prevent the transmission of HIV coming up. HIV is transmitted through a multitude of body fluids, including blood, semen, genital fluids, and breast milk that can be exchanged through unprotected sex, breastfeeding, and the sharing of needles or syringes with someone who has been infected. With that being said, the goal of primary HIV prevention is to prevent exposure to the body fluids of an infected person. The Center for Disease Control aims to use a mix of proven, cost-effective, and scalable interventions for high-risk populations via the following prevention strategies. HIV testing and linkage to care encourages frequent testing of high-risk populations. Pre-exposure prophylactic medications are given as daily doses to lower the risk of acquiring HIV through sexual activity, proven to do so by more than 90%, or from injection drug use by more than 70%. Antiviral medications can also be given to HIV-infected pregnant women and their newborns to reduce the risk of HIV transmission to infants during pregnancy, labor and delivery, and breastfeeding. There are behavior change programs out there delivered by healthcare providers, peers, and others that have been shown to significantly reduce risk behaviors among people diagnosed with HIV to help ensure they do not transmit the virus to others. Other programs that focus on substance abuse treatment that help people stop injecting drugs and eliminate the risk of HIV transmission through needle sharing, and has also been shown to reduce risky sexual behaviors. Additionally, increasing the availability of sterile syringes is associated with significant reductions in HIV risk. Thanks for listening. Reporting live from the field, I am Lena Craigmile. Back to you in the studio.
Thanks, Lena. That's some great information. Did you know that 37% of newly diagnosed individuals are aged 20 to 29? These individuals have passed the point of primary prevention. Therefore, now let's send it over to Ashley Engel in Studio 180 Rockefeller Plaza to learn how to manage HIV after early detection. This is also known as secondary prevention. Over to you, Ash.
Reporting live from Studio 180 in Rockefeller Plaza, I'm Ashley Engel. Prevention is key in controlling HIV and AIDS. If primary prevention of preventing the disease from ever occurring fails, the next step in the prevention process is secondary prevention. This focuses on detecting and treating a disease early on in the disease process. Early diagnosis and treatment is often associated with better outcomes, including slower disease progression, lower disability rates, and minimizing complications. Detecting and treating the disease early on also focuses on preventing the spread throughout the population. When people are aware that they are HIV positive early on in the disease progression, the transmission through sexual or injection partners is far lower than those who are not aware that they are HIV positive. On a community basis, the early identification and treatment may prevent others from acquiring the disease, which is secondary prevention for the infected individual and primary prevention for the community of those who are not HIV positive. Testing is the best early detection strategy possible. An HIV positive diagnosis is based on detection of serum HIV antibodies, but there's a window of time between exposure and development of said antibodies in order for the test to yield correct positive results. This means that even if someone is HIV positive, but a sufficient time window has not elapsed between exposure and testing, a false negative test read may occur. If you tested negative after known exposure, second testing should be done 3 to 6 months later to determine if infected. In an attempt to have positive secondary prevention strategies and better outcomes, the Center for Disease Control recommends everyone 13 to 64 get tested at least once, with high-risk population getting tested more frequently. The easiest way to find a testing center near you is to go to AIDS.gov. This website shows a multitude of locations where you can get tested, including doctor's office, clinics, mobile testing vans, and there's even home HIV tests. There's many different types of testing, including rapid testing and follow-up diagnostics. Test results on what HIV and AIDS mean can be confusing. The most important aspect of what HIV/AIDS screening looks for is your CD4 count. A CD4 count is essentially a snapshot of how well your immune system is functioning, which, as you probably know, HIV and AIDS attacks the immune system throughout the disease progression. Since your immune system helps fight so many things and is essential for health, the early detection is key to keeping your immune system functioning as best as possible. Thanks for your time, Como. Back to you, Emily.
Wonderful news, Ashley. Now we have a special guest who is here to share his story. To protect the identity of our interviewee, we have changed his name. He is a 37-year-old male diagnosed at the age of 17, and he is here to share his story on how he has managed living with HIV. After efforts of primary and secondary prevention, Michi is working towards tertiary prevention, which is tailored to preventing the spread of HIV and managing his symptoms. Here to interview our special guest is Dana Gregfile. Over to you, Dana.
Thanks, Emily. I'm Dana Gregfile, here in the studio with Michi. Thank you for coming in.
Thank you for having me.
Now, can you tell me a little bit about what tertiary prevention is?
My pleasure. Tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effects. After I was diagnosed with HIV, my goal was to manage and control my symptoms to improve as much as possible my ability to function and life expectancy. After this experience, I wanted to start a research study that looked into how we can manage symptoms after an individual is diagnosed with HIV.
That sounds like a great approach to dealing with this disease. What sort of methods did you implement to study the effects of tertiary prevention on HIV diagnosis?
Well, one thing I've been working on is improving the immune system status of clients. I created a 10-week group-based cognitive behavioral stress management program that consisted of relaxation skills, cognitive coping strategies, and social support. This looked into how these would affect the overall health of the clients in slowing down the disease or managing symptoms.
Very interesting. Can you tell me a little bit more about how this study was performed?
After 10 weeks, we evaluated client mood changes, hormone regulation, and cortisol, which measured depression, anxiety, and overall health. The results showed improved mood, neuroendocrine functioning, and most importantly, increased immunity status for individuals with HIV.
So what you're saying is your research shows that there are methods that help reduce the manifestations of the disease that is incurable? That's incredible.
Yeah, I'm so glad we have tertiary prevention methods that have shown to help those struggling with the disease.
I would agree. Are there any other methods you think are out there to inform others about further tertiary prevention?
Definitely. If an individual is living with HIV, there are many actions one can take to prevent passing it to others. The most important is taking medicines that help HIV the right way every day. This is known as antiretroviral therapy, or ART. This therapy can keep one healthy for many years and greatly reduce your chances of transmitting HIV to your partners.
So what would you want to say to those affected by HIV based on your experiences?
You're not alone. If you are one infected by HIV and AIDS, this is not the end. There are many opportunities to live a quality life and extend your life expectancy. All you have to do is search for what works best and stick with it.
Thank you so much, Michi. Back to you, Emily.
Thanks for sharing. If you think that you have been infected, you are not alone. There is a 24/7, 365-day-of-the-year hotline that you can call for further information or assistance in dealing with this disease. Please call 1-800-CDC-INFO. From all of us here at SSON News, I'm Emily Betts. Good night, and we'll see you in the morning.